Hi, my name is Mary. Do you know what arthroplasty is? Let me tell you. Until this past year, I had no idea what it was. Arthroplasty is a surgical rebuilding, relocation, replacement of your joints. I had it done on my right hand because after years of having rheumatoid arthritis, I had lost so much function in this hand. I couldn't even brush my hair without the brush flying across the room. I mean, it was horrible. It's better now, working on my flexion, like my occupational therapist has me doing. But I had the surgery done on February 14th of this year. So it's been a little over 2 months. 2 months and 5 days. The surgery per se was not that bad. It looked worse than it felt. It looked horrible. It really did. When they undressed my hand, it was just a bloody mess, and with 2 very bold lines of sutures and stuff of where he had cut in. But it looks much better today. Okay, if you can see, I do have a scar, but it's really hardly noticeable. And through time, it will become less so. The implants that they did, the joint implants, they removed the old bony structures and put in plastic implants. Should last 10 years or more, depending on how you take care of yourself. If you're out throwing discus or playing baseball or football, it's probably not going to last as long. If you're a lumberjack or like throwing sledgehammers around, probably not going to last very long either. If you take care of it, it's going to last you probably through the last part of your life. So, if you have anyone who has rheumatoid arthritis and has gone from this through the years, this is what rheumatoid arthritis does to you. I was diagnosed in 1999, and I thought, well, if I keep stretching my fingers and I keep rubbing my knuckles and everything, they're not going to twist and turn like that. No, I've been on all kinds of medication for my RA to stop the destruction of the joints, but it's just the nature of the beast. Rheumatoid arthritis is a very debilitating disease, very destructive disease. You know, anyone who has a low self-esteem may feel like they're going to become a hermit once they get the diagnosis of rheumatoid arthritis, but you don't have to. There are solutions out there. There are medications out there that can slow it. It's not going to stop it, but it will slow the progress. Like I said, from 1999 until now 2019, you know, this is as long as I've been battling it. So, but if you have someone that you know, they need to go to a good orthopedic surgeon and get the info there that they need. Surgeons will do it. I mean, this is a nice thing to happen when, you know, you've practically given up. I never gave up. I just said, hey, I have abilities nobody else has. I can point around corners, you know. So, anyway, when I had the surgery. It was about a 3-hour surgery, and I came out, and he had given me 30 pills, or pills, yeah, 30, I think it was oxycodone or something. And normally I don't do well on any opioids or synthetic opioids and stuff. I just can't take them and stuff. But I had no problem with that. Just taking care of it. The worst part of it, I can say, was not so much the top of the hand that hurt so much. It was the side. It got so raw here. And I had a little sleeve that I would put on to put my cast on. And, it would rub against it. I would be putting napkins down in it, or paper, well, not paper towels, they're a little bit rough, toilet paper, facial tissue and stuff, anything I could and stuff, to put down in there and stuff, try to cushion it, and it still hurt like heck. It really did. It was so raw and so sore. Then I started getting the dryness and the flaking of the skin. He told me the best thing to use, my therapist told me the best thing to use to take a shower is to get like the little things when you go in the doors of businesses and stuff, and they have the little sleeves for your umbrella. And so grab a couple of those and so tape it up and stuff, and you can take a nice shower. Just keep your hand up this way. Okay, keep your hand up this way, because you don't want the water coming in. But, you learn all that stuff as you go along. Okay, this is what I wear now. This is just my little night buddy. Then I put my fingers in, Velcro it down between the fingers. Everything, you start to look kind of robotic here, Mary. But it's not so much that I need it. It just gives me something to flex with. And that's what we have to do. We have to learn to flex those fingers. Got to learn to flex them down, 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 and back. She said don't do it yourself by pulling them down or pushing them down. No. Rely on your muscles, your ligaments. Okay, so she has me now in a soft little glove for daytime. And I won't put it on. I'll just show you what it looks like. It looks like this, thumb insert, fingers, put your fingers through your thumb, Velcro, make it secure. This you use and stuff on the table. Get that, it feels good, really. And stuff, it pulls a little bit sometimes down here, but it feels really good to rub it. Just put it on your knee and rub it back and forth while you're watching TV. She has another little torture device and stuff that she made of plastic and stuff to put my fingers in and stuff, but I'm not even trying to do that because it takes me a while to get that thing on. But anyway, I just want to let you know and stuff, it's a great surgery to have, and you can get so much more mobile. Look at this. These fingers will move, but I cannot control them. I cannot straighten these hands out straight. I can do them all the way down, but come on, who wants that kind of hand? I'd rather have this kind of hand, and this kind of hand would be great if you have the same problems and you can get it. Now I live in Missouri, and this was done through through the Veterans Administration, because I am a veteran. And those of you who have private insurance or Medicaid, Medicare and stuff, you'll have to consult with your doctor or your provider about that. I don't know. I don't know, but I'm going to tell you what, it's a good surgery to have. So I highly recommend it. I hope this has been somewhat informative to anyone having rheumatoid arthritis. Like I said, it's a very debilitating and ugly disease. So I hope that you don't have it, but if you do and you're looking for some kind of input, get the arthroplasty, everything. I don't think you'll regret it. I really don't. So I'll be getting this one done in the fall. So take care. I wish you good health. And much love to everybody.